My name's Elizabeth Eisenhauer. I was the inaugural director of the Investigational New Drug Program of the Canadian Cancer Trials Group. I started that position in 1982, fresh out of my residency training in hematology, and it was the intent that this be a brief 3-year stint. And I guess I must have really liked it because 30 years later I was still doing that position. So I retired from that position in 2012 to become head of the Department of Oncology at Queen's. Making a brief return to the CCTG to be acting director in the interval of time between when Ralph Meyer left and Janet Dancy was appointed. The CCTG has really built a Canadian oncology community for which patient outcomes and an evidence-based approach to practice is part of their core values. So I think that's a side effect, if you will, of having a collaborative group, but a really important one. It kind of means that no matter where you go in the country, you're going to be seeing people who've been part of the CCTG. It kind of means, because we've worked together to establish standards of care, that whether you're treated in the East Coast or the West Coast or the center, the kinds of things cancer patients will be told and will be offered will be similar. And we've also created opportunities for patients to become engaged in how we address these questions and contribute to our understanding of the value of the questions that we ask through our patient and lay representative network, which has kind of led the way for other therapeutic areas in Canada. Oncology was by far and away ahead of that. We also were one of the early adopters of assessments looking at patient-reported outcomes and quality of life. So while it is fair to say we'd all love to see cures for every type of cancer, if we can't cure patients or prolong survival, understanding the impact of treatment on benefiting their symptoms and their quality of life is a very important thing to measure, and we've been doing that routinely for 2 decades now.